So my name is Brianna Berry. I'm the ABA director and a BCBA here at Soaring on Hope. I've been working in ABA for 7 years now. I started as a registered behavior technician and then went to school to get my BCBA to learn more about the field. I've worked with kids anywhere from 2 years old to 18 years old. We take several classes on how ABA got started, learn about people who, how psychology developed from the beginning, integrating ABA, and how it came to be and how it's transformed since then. It was a lot different in the 60s than it is today, and more accepted today than then as well. So most of our classes are dealing with children or teens with autism, and I think that's primarily because insurance only covers ABA if the child is diagnosed with autism. But ABA is shown effective for all different developmental delays, or it can work with kids with ADHD, OCD, operational defiance disorder, but we're mostly talking about kids with autism. So we do have a lot of background and training on what that autism diagnosis entails and what those children need from us as providers. So as soon as we usually have parents call, tell us they're interested in ABA, we make sure that they have a comprehensive diagnosis. That's what's difficult today to get from doctors because it requires a lot of testing and not very many psychologists do that. So we require, because of insurance, we require that comprehensive assessment and diagnosis and then a script from the doctor for ABA therapy. From there, we meet with the parents and the child to see what could ABA do for their lives. How do we not only change the kid's life, but the parents as well? If they're having difficulty with getting their child dressed or transitioning them or even taking them to the grocery store or just eye contact and play skills, we make that a priority. So not only the child's a priority, but the family as a whole. There's various assessment tools we use based on the child's age, their functioning level, but it is partly a parent interview because, we might test skills with the child and not see them, but the parent might say, they can do this and they do this sometimes. And we want to make sure that we're getting a whole picture, their background history, their family history, any factors that could play into their therapy. So we do an initial assessment and then based on that, recommend a set number of treatment hours per week for ABA. Suggested is usually anywhere from 25 to 40 hours a week. Most of our clients right now are over the age of 12. So some of them are here because school isn't the right place for them right now. So we work on attending, compliance, following instructions, sitting in a classroom. So that intensive therapy is so important so we can get them back into the school system. We might recommend 25 to 40 hours and especially 35 to 40 for those younger kids because we know early intervention is so important, but insurance doesn't always approve that. So it really depends on the insurance and the parents as well. So those three things. Our discharge plan or transitioning them out usually starts with titrating hours. So, we work on those fundamental skills, compliance, social skills, and then we move to peer skills. So peer play or interacting with others, then maybe a group to get them ready, a small group to get them ready for school. And once we start making those improvements, we start shortening the hours. Our goal is to not keep a child in ABA forever, but to get them back into school, but make sure that they have the skills to function to their fullest potential in school. Usually, I would expect a child to graduate by that point or maybe come once a week to work on group skills. But if they're in school and if they're doing well in school and maybe they come in 1 hour a week to work on social skills or understanding social cues, and then we can titrate out of that I wouldn't expect ABA for that individual to go on forever. But always, the door's always open to come back. If a life change happens, or job difficulty, or struggling to manage relationships, they're always welcome to come back so we can work on those certain skills. And that's what makes ABA so different, is it's so individualized to each person, to what their needs are at that time in life. So our goal here, and my goal as a BCBA, is to work on skills that are functional for that individual. So a child might be able to match, or they might be able to do a puzzle and color, but maybe they can't sit for 5 minutes, and maybe they have difficulty with tolerating changes in their environment, or loud noises, or tolerating being told no. Simple commands, stop, come here, safety concerns. So that's our big focus here, is how can we get you ready for the world, and not skills that are important because they relate to, matching relates to math and being able to sort things and laundry and silverware, but also what's important right now in that stage, and how can we best benefit that child. It's not going to help a child if they have all these skills, but they don't know how to sit, or they don't know how to maintain eye contact, or maintain a conversation, or state their name if they get lost at a grocery store. So that's our big focus here, is how can we make that child ready for the world and focus on those functional skills.
Like, it's very helpful to know how to match, or they can sit still, but do they know how to make a friend?
Mm-hmm.
Or do they know how to have meaningful play? So we do a lot of meaningful play and making friends and playing with others. And so I think that parents more often than not want their children to be happy and have those other things that a lot of people on the spectrum don't have the luxury of.
So each child, of course, has their own goals, but working on social skills, we start with eye contact, conversation skills, and when a child's ready, we'll collaborate with speech, OT. They might bring a child over to work on social skills to see if they can take turns, or their receptive language and expressive language, and stating colors while they're playing a game, and while we're working on sharing. And OT might be working on sitting appropriately. So we all kind of come together to work on that child's needs in different ways, but to work on how to make that child interact with others, and maintain friendships, like you said, but also socially appropriate behaviors. So maybe, using the bathroom, we work on a lot for our kids. So picking a stall, or knocking before you open the door. It's things that we don't think about all the time, that is this socially appropriate, and it's not to change that individual, but to make them more, essentially, make the world more accepting of them as well. So right now we're working with some of our older kids to not always go somewhere with an individual. So if they don't know someone, if you walked up to one of our kids that we're working on this with, you say, hey, come with me. They are taught, no, who are you? Where are we going? To ask those questions, and teaching them self-help skills, showering, getting dressed, because if the goal is to have them in a group home, that's one less person that needs to come in that room to help them. Setting an alarm, brushing their teeth. If they can do all those skills independently, and maybe they're nonverbal, or just a delay in expressive language, they're not able to articulate what just happened, or someone's harassing them, or trying to use them or abuse them in some way. We're able to teach them, these are the things that are okay, this is what's not okay, and this is how you can ask for help. Yeah, so ABA, sometimes it's a myth, or people have this idea of ABA that it's abusive, and it's like training a dog. That's what I hear a lot from parents, or you're just making them do things and it's very repetitive. But ABA works because it is repetitive, and that's how we find that most children with autism learn best, is that repetition. practice over and over again and working on those skills to, like I said, not change the child, but we use ABA in our everyday lives. So we go to work because it's gratifying. We get paid. Just as we're teaching these kids, sit down and then you get to play. It's those simple contingencies that we're teaching these children to go on for the rest of their lives and use those things we teach them. So self-help skills, expressive language, communication, all of those things that we do intensely, or maybe it's focused treatment, but to help them grow as an individual. So it depends on the child, but it really starts the first few weeks of ABA, we take it pretty slow on the child. So first, before we can get any compliance, and that's how it is with any individual on the spectrum or not, you need that rapport there. And so we try to build that rapport with each child, play with them, make them see us as we are here to help you, and we're your friend, and you can succeed here. A ton of positive reinforcement. So praising them. A lot of the kids we get here have negative experiences at school or from peers, and we want them to feel comfortable here, and praise them for all the things they are doing instead of what they're not doing right. So after we build that relationship, starting with simple demands. So sit down or come here, to work on that compliance. Each time they do it, we reinforce them for that. And then we kind of go from there. So I think that we have some kids that come in and are super compliant, but like I said, sometimes that can be not the best thing. We need to teach them to stand up for themselves and to say no. So it's not always, ABA is not always teaching the child to say yes every time. Is what's really hard to teach. And we have to figure out for each child, how do we teach this and what's necessary right now? And so it starts simple, like, having a person come in that the child doesn't know and say, come with me, and they say no. Or this person's touching you, you don't let them touch you here, or you don't need to go to the bathroom with this person. You go by yourself, and teaching that independence, and, whatever they need to do to stand up for themselves too, but also learning that authority is different too. So teaching them about police officers and firefighters and even teachers, that respect there, and, following through with simple demands, and how your relationships are with each set of people. So you might kiss your parents and give them a hug, but that's not appropriate for a stranger at McDonald's. So teaching them those relationships and what's an appropriate response in each setting. So they might be able to jump and run around and wrestle kids at home. But here, this is where we work and we sit, just like school. So it depends. Our younger kids that are usually under 5 come here 35 hours a week at least, maybe 40, to do that intensive therapy to get them ready for school, and using those hours to kind of catch them up to their peers before they go to school. Our older kids, we have some that come after school, maybe only for 12 hours a week or 8. And then we have some that come 3 days a week and skip some school. So it really depends on the individual, how much they need. So working with children, I've had kids before that they're only allowed to go to school for 2 hours a day, and because of their behaviors and those maladaptive behaviors that are preventing them from going to school all day, which also affects the family, because then parents might be able to not have a job or have to put a hold on the things they're doing in their life to make those adjustments, or their siblings as well. So going to work with the school, going to IEP meetings and advocating for these kids, that they receive all of the services that they are entitled to. So ABA, we're taught there's 4 functions of behavior. So attention seeking, escape maintain behavior, sensory, or tangible. So if the child wants something. So based on those functions is how we react to the child. So when ABA first starts, it's such a change of pace, and a child might learn at home or at school that if they cry and scream and kick, they get what they want, or they get a cookie. We're trying to find replacement behaviors for that, for appropriate responses to get that same that response back. So teaching them to ask appropriately, using an AAC device, or tap on someone's shoulder to get their attention in place of screaming. So depending on the child's function of the behavior is how we treat it. So yes, we do see a lot of distress sometimes where a child might feel overwhelmed. In that case, we take them into another room or start slow and build up to them tolerating those noises or other peers being around them. And if they appropriately ask, like, I don't want to do this, that is our goal, is to teach them ways to remove themselves from a situation, ask for a break, or say, I'm shutting down, I need this from you, or I don't want to do this anymore, I need help. That is our goal, because right now a lot of the children we're getting, they have that expressive language delay, or maybe they're nonverbal and they can't say to their teacher, this is too hard. And so they might be pushed and that behavior escalates. So we try to form it, taking it easy day by day and forming that correct response for them.
So in the situation of like a meltdown or something to that effect, I guess first, how do you view meltdowns, and how were you trained maybe or taught about meltdowns in the first place?
So I was taught, going back to those 4 functions behaviors, there's a reason for that meltdown. In ABA, we are taught there is no behavior happens for no reason. So someone might say, he just started out of nowhere screaming and crying. Well, something had a factor in that. And it might not be something we see or hear, but that child hears it. Or something set them off, someone walking by the door, or the lights flickering. So taking all of those factors into consideration. So we're really taught on how to respond to meltdowns and what causes them. What I've been taught and what I've seen the most is a lack of communication. So a child engages in those meltdowns, and it might be screaming, it might be throwing things, it might be just sitting there and completely shutting down, avoiding eye contact because something is going on and they're not able to tell us why. And so that is our goal, is to get out, that communication piece so we can prevent that from happening and give them an out that's appropriate. So it depends on the child and why they're doing it. So if a child might be sitting in the corner and they're screaming because we have our back turned to them, we might wait until the second they're quiet or the screen goes down just a little bit, and then we say to them, oh, great, now you're quiet. I would love to talk to you, because they want attention. Or maybe teaching them while they're screaming to tap us on the shoulder, or, using an AAC device, I need this, or look here. So teaching them an appropriate response for that. If a child, we might be working on a task and they throw the paper or throw the puzzle pieces, then we work on, okay, we're going to do this, and then next time tell me no. Or if this is too hard, and telling them beforehand, if this is too hard, let me know. So giving them those options to work through that behavior. But it really, the goal of ABA is to teach them replacement behaviors. So that might take, like we said, like a lot of repetition. And sometimes it's really hard because those behaviors have been so reinforced in the past. So it takes a while to replace those things. If you're saying like a tantrum occurs, how do we handle it? But it really depends on the child.
Yeah. So, I think one of the things to talk about, if we decide, are we going to ignore the behavior and continue with the demand? Are we going to...
Yeah.
I think there's a misunderstanding that also we don't want the audience to feel or believe that, okay, we're just going to let the kid get out of sitting still. All they have to say is no, because once they learn to say how they feel, then we take to the next level and say, okay, you may not want to sit still right now, or you may not want to do this task, but when you've completed it, you can move on to something you enjoy.
So, and I mean, if a kid is feeling overwhelmed, then we might take them to another room. But like Jessica said, like teaching them right now, right away, yes, you can say no to this, say no to this, say no to this. Then maybe next time you only get to say no twice per session. And then next time, you know what, we still have to do this because sometimes you do stuff you don't want to do and you have to do it because it pertains to school or your job or just life in general. That's what makes us so different from any other practice and school, because if a child has a meltdown for 2 hours because they don't want to do work, we have the availability here to work through that behavior and sit with them and teach them we still have to do these things, but you don't get to escape and you don't have to go to a sensory room, because it is a common misunderstanding when meltdowns occur that child needs a break. And so quickly children learn, if I just cry, I get to leave the room, leave the classroom, I get to go take a nap or go to a sensory room, which is a lot better than doing this.
Or they'll call mom and mom will come get me and I get
Yep.
to spend time at home. That's a common start from the beginning of that, because that's really...
We've had children that are, older, and after a meltdown, they go and grab their backpack because they think, I do this at school and I have to go home. Whereas here, we give that parent that reassurance that this is going to be tough at first, but that child, we will not call you and tell you all these negative things that may have happened during the day. We are going to talk about the positives. And we'll tell you about what negative things happen, but that doesn't need to be the focus. So teaching that child, we had some kids that would grab their backpack and we teach them, each day, no, we're not leaving. We still have to do this. We're still having to do this. Oh, now you can go get your backpack. We're done. They quickly learn. They get excited to come in because they know that's not going to work anymore. I feel like maybe a meltdown would be more sensory, but all of our behaviors, how we define them, is based on the function of it and the topography of it. So what it looks like. So either we never classify something if he's having a meltdown or he's having a tantrum. We say he's engaging in hitting others, or he's hitting himself, or covering his ear. So very specific, because often all those behaviors occur maybe at one time, but what is the function of those behaviors and what do those look like? Because a parent might say, my child's having a meltdown, and that might mean the child's just crying. Whereas another parent might say the child's having a meltdown and he's throwing things or hitting others. So it's really important for us to talk to the parents in the school and know here, what does that mean? What does that behavior mean? Yes. Yeah. And some of it is we collaborate with the OT. So, we might, if a child's really overwhelmed with noises or others in the room, we might start with them in a room just by themselves and to work on those, simple sounds that are in every single space that we can't block out. But we want to really work on those things, because at school, they'll be around peers. And at the grocery store, they'll have a lot of crowds and a lot of noises going on the cash register and people talking and things being dropped and lights everywhere. So it's really important for us to work on what's practical too and what gets them ready to function every day. But a lot of it's OT too. A part of that is collaborating with them and saying, we see this child, he's having meltdowns because of sensory overload or not enough sensory input. So that's something that we kind of send to the OT, because that's outside of our expertise too.
Meltdown, tantrum, the actions. In those situations, because I know that a lot of times a reaction might be considered a reinforcement of that behavior. So do you kind of just observe, write down what's happening, that kind of thing, or do you intervene, or how does that work?
Correct. So that's how we kind of start, is during our assessments and the child's first weeks, seeing what behaviors come up. We take data that's called EBC data, so the antecedent, the behavior, and the consequence. So the antecedent is what comes immediately before that behavior, and that goes back to a parent or someone saying it just happened out of nowhere. We know what happened immediately before to cause that behavior. based on that, we can figure out our consequence. So if it's a child, he might take off his clothes, because then everybody's like, oh, put on your clothes, what are you doing? Or stimming or throwing things. We know we're not giving that attention because that increases that behavior. So we're not going to let the child go home, get his backpack and go home, because that just increases the behavior of him being aggressive and having those meltdowns, and he learns he gets to go home. So it's so important for us to have a consistent consequence for every single behavior, and that's why collaboration with the school is so important, other providers and parents, so we're all on the same page of how this child can make progress and to increase positive behaviors and replace all of those negative ones. So consequences for a child might be ignoring, and it's not turned around and away from the child or leaving the room, but it's not focusing on whatever behavior they're engaged in, whether it be screaming or throwing things. Another consequence might be letting them take a break, or having them request appropriately for something. If they want to go on the swing, then we'll have them request appropriately, then take them. Maybe it's following through with the demand, which is so important, because of a lot of those behaviors we see from our kids are because they want to get out of something and their escape behavior. So making sure that we follow through with that demand, then let them kind of guide the way. So we know this is, even though you're trying this, we're still going to continue it.
I know there can be maybe a few different ways people approach that. So would that be a skill taught by itself, or would it be like ingrained with something else? Like, is there an explanation of like why we're sitting, or are we just sitting because we're supposed to be sitting because you said so, or like how's that work?
So again, it's going back to like those expectations of each place and each situation that child's in. So teaching them, hey, you know what, we're going to the bounce house. We don't need to sit in here. We can jump around, but sitting here because we're sitting at the table, let's work on this. And usually it's littler children that we work on this, that they first start ABA, and we'll sit them in a chair and say, okay, let's sit. We start 5 seconds. Okay, good sitting. Now you get to get up. Next time, 10 seconds, and increase that to work on those sitting and teaching them it's time to work. Then we get to go play, and teaching them different responses in each place they're at. So if the child is receptive to instructions and receptive to our language, we'll explain it to them. You know, this is why we're doing this, or this is what we can do next. Otherwise, using a visual first, then. So it really depends on the child of how we're explaining it to them, but making sure they understand the expectation.
And with those skills, going back a little bit, you're mentioning like skills that they can use in, real life and all that. Do you ever see an issue with them having trouble generalizing those skills to other situations?
Yes, and generalization is what we work on a lot in ABA. So we make sure, that's why collaboration with other practices, school, and the parents is so important, because if we're teaching him to sit at home or sit here, but he's not sitting at home, it's not functional, and it's not practical for us to do that if he's not doing it at home. We need to change what we're doing to make that child more able to do those things in every situation and generalize those skills. So it's really important to ask the parents at each meeting, how is the child doing? And parents will say, she sat for the first time during dinner and we were able to sit there as a family, or she only sat for 5 minutes, but that's huge. So those things, if we're not hearing back from the parents that it's generalizing at home, we need to work on those skills and change how we're teaching it. But also in ABA, we work on generalization across people, and that's why each child works with different therapists, places, so they work in different rooms, and they do skills like maybe going to greet peers, not only in the ABA area, but they're going in the waiting room, or over to the other hall with OT and speech. And then also the third generalization skill is places. Did I say places? So
places
and stimuli. So also like they're not, maybe they, we tell them to sit down, but they also listen to and different responses for those different things. So we want to make sure generalization occurs across all environments. So parent involvement, we make sure the parents either meet with me twice a month, once a month, and we work on teaching the parents how to do what we're doing here at home. And also telling them that it's not always practical because it's your own child and you might be tired from work or you might lose your patience and you just need 5 minutes. So it's also connecting with the parent and telling them like it's okay that you're not constantly having your child work on these things at home, or sometimes you give in, but to, take it one step at a time. Work on, hey, just for 5 minutes a night, have your child try to use the bathroom, or start using this at home, using a token board or visual, and positive reinforcement, and giving them tools step by step to have it generalize at home as well.
You kind of mentioned stimming a little bit. As a general, do you see stimming as something that should be like worked on to minimize, or is that kind of just up to like what the parent would prefer, or how does that work?
My belief is stimming, I was always taught that there's a reason for it. So sensory input or and what I hear a lot from parents, well, it makes my child happy. And I don't want to take that away from them. If they're spinning in circles or flapping their hands or pacing, it brings them joy, and I don't want to take that away from them. And I totally agree with that. I think we work on those things when it starts interfering with the child's learning and being able to attend in a learning situation, and also when they're in social situations. So teaching them, when we're working, our hands are in our lap, and then when we get up, then you can play and spin or flap your hands. But when we're talking to others, our hands need to be down and we need to give eye contact. So I think just trying to, again, teach that child that in different situations, these things are expected and these behaviors are not expected.
Really quickly, is there anything that you personally would want to tell the whole entire world about ABA that maybe they don't understand?
ABA is just life-changing. It's not just about the child, it's about the whole family. And ABA is not trying to change any child or change any teen or adult. We are just trying to bring out what they can do and find different outlets for those things. So our focus is not what the child can't do, even though it might feel like that sometimes with assessments and negative reports from school or from different centers. But our goal is that child can make progress and that child can soar with all different goals. So our intent here is to really focus on that child and have them grow to the best of their abilities.